Ladies and gentlemen, Chairperson Marisa, I'd like to thank you for kindly inviting me here today as a member of the Cabinet for the European Commissioner for Research, Innovation and Science to talk to you about what our policies are in the area of cancer. And as one can see by the commitment from members of the European Parliament that this is a key issue, a massive political issue for MEPs as well. And as has been emphasised already during this debate, it's very important that the European Commission and the European Parliament work together on the programmes that we're going to put in place into the future. Cancer is everybody's problem. It's a European problem, it's a global problem, it's a social problem, it's a health problem, it's a personal problem, it's a family problem. And the point has been re-emphasised here time over that in the context of framing our policies in the area of research, innovation and science and in the area of cancer research, that the participation and consultation of patients, those who have suffered from cancer, those who are suffering from cancer, must be taken into account at every aspect of the policies that are pursued by the European Commission in this regard. Maura Geoghegan-Quinn is the Commissioner for Research, Innovation and Science, and health is an issue of deep personal commitment to herself, and in fact the first conference that she addressed in the European Parliament since becoming European Commissioner was on the issue of what the EU can do in the area of healthy ageing, and that was an indication both to the European Parliament that health is a big issue of concern to her. So I'd like to focus my comments on two key issues. One relates to what the European Commission is doing in the area of cancer research, and secondly, to just talk to you about some of the political guiding principles concerning the forthcoming research and innovation strategy that Commissioner Geoghegan-Quinn is drawing up and that will be presented to a meeting of EU heads of state later this autumn, because these are rivers that are running in parallel but are linked in many ways. Cancer research is a priority for the European Commission, and between the period 2007 and 2010, €300 million has been allocated for cancer research from the 7th EU Research and Technological Framework Programme. The EU cancer research programmes that we operate are done so on a European-wide scale, and we seek to link research, prevention, diagnosis and treatment while seeking to promote a greater level of coordination between national governments in the area of research. A few practical examples of what is being done under this research programme, better known by its acronym FP7, include improving networking cancer registries in Europe for research purposes, cancer research institutes to jointly tackle the development of new cancer biomarkers and better diagnostic tools, coordinating national research efforts in the area of rare disorders, and performing investigator-driven clinical trials. But we all know we have to do more cancer research in the European Union, and we need to provide the people who are in the front line with the political and regulatory and financial weapons and components so that they can help to fight cancer in a more effective way. And once again, that includes patients, doctors, governments, public health authorities, companies and researchers. And it's been a point that has already been emphasised here today that coordination is the best way forward here, both involving all the stakeholders. A lot of people should not disguise that a lot of people believe when they look to Brussels that institutions, are put in silos. And when it comes to the issue of research, innovation and science, that's just not good enough. The EU governments and the European Commission and the European Parliament must work together with an agreed policy framework so that we can achieve our policy goals, and this is very important in the area of cancer research. We have to convert existing and new research into meaningful clinical applications, such as new methods for detecting and monitoring cancer diseases, new therapeutic approaches to cure cancer, and new and more efficient clinical practices. And if we are to achieve these objectives, we also need to perform clinical trials and studies proving the effectiveness of these diagnostic tests, the efficacy and safety of the new treatments, and the effectiveness of good clinical practices proposed. And as Professor McVeigh said earlier on, the participation of patients at all aspects of clinical trials, from start to the finish, has to be a central component of policy making. And that's an issue that I can assure you I'm going to bring back to our DG and to the Commissioner when I return from this meeting. I would like to acknowledge the work of the Innovative Medicines Institute, the IMI, which is a European public-private partnership between the European Union and the European Federation of Pharmaceutical Industries and Associations, for the support of this organisation for pan-European clinical cancer research. On a second point, Commissioner Gagan-Quinn, as I mentioned earlier on, is drawing up the research and innovation strategy, and she has consulted widely with many groups from the business, social, investment and voluntary sector, and including with groups from the European Parliament. And I'd like to just talk to you about some of the guiding principles which she is using in putting this innovation strategy, research and innovation strategy together, because it is important in the context of the formulation of future policies in the area of cancer research. The bottom line here is that if the European Union is going to become a leader in the area of innovation, we have to remove political and regulatory blocks that stand in the way of putting in place a proper innovation ecosystem. It's already been referenced earlier on that there's barriers been put in place between patients going from Brussels to Paris, a train journey that's only an hour and 10 minutes away. If we don't remove these political and regulatory roadblocks, we can't innovate. We're not in a position to create the culture and the background to allow new products and new services in an innovative sense to come to the marketplace. Better innovation at its principle is the development of new products and new services which will improve the quality of life of our people and to build a better society both within the European Union and around the world. And let's not forget, the European Union has the technology, we have the research. 31% of all patents in the world emanate from the European Union. 31.4% of the patents in the world come from the United States of America. So it's not as if we're lagging behind in terms of research and technological capability. We just have to adapt it and use it in a stronger sense. We also have to increase private sector involvement. Private sector involvement in research at the moment only stands at 1.15% R&D intensity. That's compared to 1.67% in the United States of America, and that's simply too low. And while one can reference the success, and I feel that's by any objective yardstick, the success of the IMI, which is a public-private partnership, it's very important that we pool and secure the best talents from the private and public sector in bringing forward policies in the area of health, cancer research and in other policy areas to promote the European research area within the EU. Also in the area of health, we need to ensure a higher level of participation of small and medium-sized enterprises. As a lot of SMEs are drawing down quite a lot of funding under FP7, but in particular technologies such as nanotechnology, and these key enabling technologies are vital in the future development of our health strategies and in the future development of an innovation strategy within the European Union. But I would just like to come back and finish by just talking about in brief on a matter which has been touched on already here, and that is to do with the international dimension of research, innovation and science. On the one hand, we are saying that the institutions, the governments, the Commission and the Parliament and the EU governments must ensure that we work together and coordinate better and avoid the duplication or fragmentation of research effort. But in fact, we have to work in a much stronger capacity with our international partners around the world and with third countries around the world. And in fact, the European Union already has 20 science and technology agreements with third countries, including the United States of America, and Japan and India and Brazil, and we have already started 3 joint calls to look at the link between infections and cancer, and those 3 joint calls are operating in Latin America, Africa and in India. And so in pursuit of excellence and in pursuit of the best research and technology, the coordination has to be in a global capacity, not just in a European capacity, but we know we have problems. Events like today give us an opportunity to highlight what those problems are so that we can go back to the European Commission and MEPs in the European Parliament and reflect on how we move forward here, both in terms of the research and innovation strategy and in terms of the future thinking concerning FP8, which is the next research and technological framework programme 2014 to 2020. So they're my concluding remarks, but I wouldn't like us to forget the purpose of why we're here today. We're here today because we're talking about people, and we're talking about people who've got cancer. We're talking about the rights of patients, and we're talking about how best we can help those people who are suffering from cancer, their families, their friends, and the overall environment and social implications of cancer as identified by the chairperson Marisa earlier on. And the message I'd like to give to you today is very clear. United we stand, and divided we fall.